Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon, everyone. Dr. Strang will now give us an update on where we stand with COVID-19 here in Nova Scotia.
Thank you, Premier. Good afternoon, everybody. Today we're announcing 30 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 579. There are currently 11 individuals in hospital, 4 of those are in ICU. We now have 176 people that can be considered to be recovered, so that's 39 more than we had yesterday, and that's good news. And as we move through this, we'll continue to have more and more people recovering. As part of that, we now, as of today, we've had 18,453 people, or Nova Scotians, who have been tested and are negative. As you've heard me say before, that's testament, the ability to have so many people tested is testament to my colleagues at the lab. And yesterday they processed 1,065 tests, and so they continue to do great work. I know that there's been a lot of interest in the numbers related to long-term care facilities around COVID-19, and it's an area that I've been asked about, and we've certainly done some work in that. So as of today, if people who receive the news release that you can see, we're going to start reporting on a daily basis as part of the news release numbers related to long-term care facilities. We just want to remind folks those numbers are collected and they're reported as of a certain point in time early in the day, and things do progress throughout the day, but with the numbers we will stick with the numbers that we get and report first thing in the day. So as of today, I can tell you we now have 7 licensed long-term care facilities that have cases of COVID-19, and in total, amongst those 7, that's the 7 facilities, we've had 42 residents who have tested positive, along with 23 staff. As we've talked about previously, protecting long-term care facility residents, supporting our long-term care facilities with comprehensive steps from the health system approach is a priority for us in Nova Scotia. It's a key part of our health system response plan. As we've talked about, we've started with several weeks ago preventing visitors, preventing trips out from the facilities. We now have comprehensive directive in place which deals with all the steps that long-term care facilities need to take, both to prevent cases and how they respond if they do get cases and even an outbreak. We are now providing masks and directed that all frontline healthcare providers, including those in long-term care facilities, wear masks as a preventive step to minimize them transmitting the virus to their coworkers or to residents. So that it remains an area of concern. It remains a focus of attention as well as part of our response here in Nova Scotia. And I just want to end off by saying that as we've talked about since the modeling, I've had a number of questions about that, but the overall message is that many Nova Scotians are doing, following public health directives, doing what we're asking, telling them to do. We are seeing the impact of that, comparing our actual epidemiology to some of the modeling. We are certainly seeing that the impact of strong adherence to those public health measures. So we continue to have new cases, but we're not seeing that a dramatic spike in cases. We have a couple of areas concerned that we have robust response plans in place. So while it's concerning, we're doing some good things here in Nova Scotia. We need to continue to do all those good things for the weeks ahead, but I want to take the opportunity to thank all Nova Scotians who are doing the many hard things that we're asking them to do, but all important to help us prevent the spread of COVID-19 and minimize its impact.
Thank you, Dr. Strang, and we'll be happy to answer any questions that you have.
So we'll go to the phone lines now. We'll take one question and one follow-up from reporters on the phone in the allotted time that we have. Again, please ensure that your phones are on mute. We'll start with Mike Gorman from the CBC. Go ahead, Mike.
Thanks. Premier, yesterday, HRM all but acknowledged what Dr. Strang has been telling us for weeks, and that's that this summer is going to look very different. and as a result, they laid off a significant portion of their workforce, I think about a third. And the lion's share of those people are seasonal workers. Given how many provincial seasonal workers we have in this province, and given that Dr. Strang has said that even when restrictions get eased, it's not going to be going from nothing to everything right away, at what point are you and your government going to make a decision about whether or not you need to issue layoffs to provincial public service workers?
Well, we don't see that'll be required at this time. Obviously, we'll continue to look at it. We've called some of those seasonal workers back now, depending on what sectors they're in, but we are not contemplating any layoffs.
Go ahead with a follow-up, Mike.
Thanks. Dr. Strang, when you presented the modeling on Tuesday, you talked about, as it relates to hospitalization, the difference between what can happen with poor compliance and good compliance. But as I've come to understand, poor compliance doesn't actually mean a worst-case scenario. And yet, in your own words and the words of the Premier on Tuesday, poor compliance would lead to placing the healthcare system in significant jeopardy. And I'm wondering if you can talk a little more about that, because the hospitalization rate that the poor compliance would suggest in the modeling is still well below what Dr. Carr has told us would be available both in terms of acute care beds and ICU beds across the province. So can you talk to me a bit about what the concern would be in that poor compliance rate in terms of the hospital's ability to meet that demand?
So I think we have to understand a couple of things in your question. Yes, we modeled poor compliance and good compliance. The worst case scenario, however, we didn't do. I mean, the worst case scenario is that if we didn't have any public health measures implemented in the first place, so there would be zero compliance because we don't have anything. And those are the ones where we have a catastrophic and completely overwhelm the healthcare system. But even within the poor compliance, there would be substantive stresses on the healthcare system, because you have to understand that we have hospital beds and ICU capacity that it's not just for COVID-19. We have certainly decreased a significant number of people that are in hospital, but there will always be the need for non-COVID related health emergencies, whether it's people with cancer, other catastrophic illnesses, trauma, which are going to drive the need for hospital beds, for surgeries, and for ICU. Our compliance modeling scenario would overload our healthcare system. That is why we need one of the key reasons why we need to be in the strong compliance scenario, which our current epidemiology matched up to the modeling shows we're in. But there is room to get better. But we have to stick in that strong compliance capacity to make sure we do not overwhelm our healthcare system. But first and foremost is that the stronger the compliance, the fewer people get affected, the fewer deaths we have. This is ultimately about saving lives.
Next, we'll go to Alexa McLean from Global. Go ahead, Alexa.
Good afternoon, Premier Stephen McNeil. On Monday, I know you got asked about concerns around staff shortages at long-term care facilities, and you made the point that now is not the time to negotiate contracts or discuss staffing models. However, we continue to hear that staff shortages that existed within these facilities have just been intensified because of COVID. Workers have to self-isolate, take care of their kids, etc. I know that this is a question, too, on the federal front. I'm just wondering specifically how the province is supporting workers who have had their issues with staff shortages intensified because of COVID in the long-term care facilities.
Well, it's a combination of not only directly with long-term care facilities. We have primary health care facilities where we're looking at how do we best deploy our nursing staff. There's been collaboration between the Nova Scotia Health Authority, Public Health, and some of our private operators within the province. I don't know, Dr. Strang, whether you've been involved in those conversations.
Yeah, I think there's ongoing discussions every day, especially in the continuing care sector, where there many of the challenges are about how we respond, as I've said previously, briefings, not responding facility by facility, but having more of a health system approach. So how do we actually allow facilities that are getting into challenges with outbreaks, how are they supported by staff from other parts of the healthcare system? It is an ongoing challenge, but I think working as a system and being as flexible and as mobile as we can, as well as we're putting things in place that we can actually have healthcare workers who may have been a close contact, but ways that they can come back to work and not have to be on self-isolation with strict protocols. All of those pieces in place to kind of preserve our healthcare staffing as best we can.
Go ahead, Alexa, with your follow-up.
Thank you, Tina. Just switching gears now, focusing on community spread. The Health Authority has issued several advisories of potential COVID exposure on bus routes and grocery stores. With community spread in mind, just wondering about enforcement. Is this an area of concern? Are these areas, grocery stores, transit, with people perhaps still going there in high numbers using these bus services? Is enforcement and inspection going to be considered when we think about trying to reduce community spread now that we're going into a few more weeks of these measures in place?
Well, enforcement and inspection is part of it, and we do have, I'll start with many grocery stores. They're doing a lot of great things within the environment that they can control to limit numbers, keep people separated, keep their staff safe. The same with transit. We still need to have buses running. People, many people in our community rely on buses, but how are we doing that? And I know HRM has taken some steps to ensure that there's a certain number of people on the buses and the drivers are protected. So that's the first step, is that whoever the employer is in many sectors are doing really good things to keep their environment, and when you're serving the public, where you're allowed to continuing to serve the public in an appropriate way, respecting the rules and the health protection order. Compliance is part of that, and we do have, whether it's police, looking at lineups around big box stores or grocery stores. We have a number of other kind of compliance staff within the Nova Scotia government, whether it's through Department of Environment, Agriculture, Fisheries, or the labor and occupational health and safety folks. All of those are involved in compliance as well, and that will continue. And there has been a particular focus on working with the grocery stores and the big box stores to making sure that they are serving people in a safe manner, and I think they are. The third piece, however, is the public. So how does the public play a role? What are they doing to make sure that they are respecting the rules and they're not lining up unnecessarily? That if they're not going into the store when there's already a few people in there. So it's all those three pieces together: the operator, employer, taking care of the business and working environment. We do have compliance that works with them. We always try to work in an educated, positive way first, but there are rules that we can bring to bear and penalties that can be brought to bear, working with police where necessary. But then the third piece is how the public have to take some responsibility, and I keep saying use their common sense about how are they going to help create a safe shopping environment for other people in their community.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. I want to go back a little bit to the long-term care homes, if we could. I know Northwood is actually doing recruiting on its own, and they've actually gone to look to the restaurant sector. In other words, to augment their kitchen staff, that kind of thing. And I guess on some days they're down as much as 30 to 40% in staff. Is there any kind of a backup plan that's in place that the province can do to help augment some of the things that some of these homes are doing to try to keep staff levels acceptable?
So as I said, we have a continuing care table that is working every day, 7 days a week. And any facility that runs into staffing challenges, that continuing care group, we have on a number of occasions we've showed creativity and flexibility. And again, so the facility is not left on their own. The rest of the continuing care sector, and if necessary, the rest of the health system is there to help them with their staffing issues. We've had direct conversations with Northwood today, making the point that if and when they need help around staffing, the rest of the healthcare system is right there to help them. That doesn't mean that they can't on their own go out and innovatively reaching out. So the thought of them reaching out to restaurants to get food service workers, good for Northwood. There's lots of different ways that they can reach out for help, but they need to know any long-term care facility that the rest of the healthcare system will be right there to help them to do what we can to continue to provide necessary staff for essential care. And that's not just nurses and LPNs, and we can also bring cleaning staff. We also can have kitchen staff. So there's a whole range of people that are a part of the healthcare team that we can bring to help any single facility out if necessary.
Go ahead with your follow-up, Keith.
And this one's for the Premier. I'm wondering about food security. I know you've been asked before, but it seems like we're farmers, at least from what we're hearing in the Valley, are a bit behind in terms of their needs for this year. Do you have any concerns? I mean, you come from an area in the Annapolis Valley where there's a heck of a lot of farming done in Nova Scotia. What is your take on how things are going to proceed over the next little while in the farming community?
Well, obviously, food security is critical, particularly when you're starting to see across the country a number of our abattoirs that are being closed because of COVID-19. We've seen huge supply. You would have heard dairy farmers who having to spill milk as opposed to be not enough place in the market being able to get out of here. So those are major concerns for us, along with poultry. The Minister Caldwell is working with our colleagues. We're working with the food retailers. How do we ensure that we get that Nova Scotia product on shelves? At the same time, the national government has announced temporary foreign workers will be coming into the country. We as a province are welcoming some of them into our province today. They'll follow all of the same health protocols as all other people coming into our province. That will help towards the planting and the production of our agricultural sector.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. For Premier McNeil, I'm wondering, there's an email petition going around today to MLAs across Nova Scotia, and it talks about access to PPE, and it's calling on government to provide better access for all healthcare workers. I know I've spoken to several MLAs today who've received this. I'm not sure if you've seen it or not, but they're looking for Nova Scotia to follow the lead of other provinces and reach agreements with healthcare workers in relation to PPE. Do you have any response to this? Can you update us on the supply or any discussion you've been having with healthcare workers in relation to this?
Sure. That letter was reissued today. It was issued a few weeks ago. We've supplied all patient-facing healthcare providers with masks. They'll be wearing surgical masks, following all of the, whether it's actually in long-term care facilities in our hospitals, in addition to home care, doctors in their offices will have access to surgical masks to be able to use when they're engaging with Nova Scotians. We'll continue to work with our healthcare providers, and there are health protocols, occupational and safety protocols when it comes to other medical supplies and equipment. So N95 masks, for example, is a protocol that we would follow. All of those would be in place. As I said before, we had supply to the end of April. If orders that we have booked continue to come in, we'll have that into May by now. And we're constantly looking for new opportunities. So we identified a single deputy minister, Fred Crooks, who's leading that. I had a call last night with our Atlantic premiers looking at where is the possibility of more production and supply of goods right here in our own region, which we're continuing to look at. So we're confident in our supply, and we've continued to make those investments when it comes to ensuring that our healthcare workers who are coming into work have an opportunity to come and provide them with the equipment they require.
Go ahead with your follow-up, Natasha.
Thank you. For Dr. Strang, we obviously know Northwood has been hit pretty hard with COVID-19. Today they say they have 38 residents there who are affected. We are hearing some concerns from people who have loved ones at that facility who are concerned that perhaps residents who have tested positive have not been separated fully from residents who haven't tested positive. Is there a protocol in place, or is there something, are you looking at putting extra measures in place for long-term care facilities to ensure that this happens, or is this something you're hearing of?
So I actually had a long conversation with the director at Northwood, who's in charge of their outbreak response. They are actually cohorting people. So anybody who tests positive, they are within the floor that they're on. They are separating them from other residents. They have all the nursing protocols in place that would respect staff and infection control measures, that they would not be transmitting it between patients. So they're doing, they are isolating the known cases within each of the floors and units that people are on. They also have created a COVID treatment unit. So anybody who becomes more severely ill, any of the residents is moved into that COVID treatment unit and is receiving direct care there. Dr. Barry Clark is overseeing that, and they have a very high level of skill to be able to treat people within their facility. Fortunately, my understanding is there's only 3 people that are become sick enough to actually need to go into that COVID unit. One of the very interesting things we're seeing at Northwood, and it shows us that we have a lot to learn about this virus, is even though they got 38 residents now test positive, some of them have had no symptoms whatsoever. Some of them have very mild symptoms that may only be sick for a day or two, and then they start to feel better. So, which is good news, that even in a very a population that's at increased risk for severe disease, what we're seeing by and large is a mild disease. But that doesn't mean we don't have to still apply all the necessary outbreak control precautions that we can. There are some challenges within that facility that we're working with them on to how do we bring extra resources, or perhaps move some of the residents to other locations. But we have to be, as we even think about those, we've got to be very careful that we don't then take the virus with us and then create an outbreak in another location.
I think it's important to say that we know this is a cluster. We are through public health and through our partners reaching out to Northwood to find out what is required, whether it is support staff, nursing staff, cleaning staff, whatever is required to help control that, just like we do in communities. And Dr. Strang and continuing care at Department of Health are working with Northwood to continue to try to mitigate the spread of this. This is, to be perfectly frank, it's the place that I was going to say scares the heck out of me, but it terrifies me, quite frankly, that it ends up in a long-term care facility. And we are taking this very seriously. And we'll do whatever we possibly can to protect the loved ones of those Nova Scotians and beyond who are feeling quite frightened about what's happening in a long-term care facility. We're seeing this situation happen across the country, and that's not what we want here. It's why we locked our nursing homes down early, and we'll do everything we can to slow the spread of that virus in our communities, but in particularly in our long-term care facilities.
Next, we'll go to Olivier Lefebvre, Radio-Canada.
Merci beaucoup. My question is for Premier McNeil. I'm following actually on the question asked from my colleague on protocol that are asked for equipment protection. So I want to know, why are you opposed to have those on the front line of this pandemic, those you praise for the good work, why they cannot decide from themselves if they need extra protection?
Well, there's health protocols across the country. It's not unique to Nova Scotia. They would follow those. We provided them with surgical masks. In addition to that, there would be other steps that they would take around whether or not they felt they needed other different masks, and that would go through the health protocol in that particular facility in our system. And it's also, we need to continue to make sure, as we've seen in other jurisdictions, quite frankly, people who, when it came to equipment, had used a lot of it on the front end of this virus and are now scrambling at the peak to identify where they can find the appropriate level of gear. That's why we worked very hard early on to make sure that we had the procurement in place. We do now. We feel very confident the surgical masks will be distributed to everyone who's dealing with facing with patients dealing directly with Nova Scotians. And at the same time, we have the N95s and other masks that are related to dealing with this issue, and they will be distributed based on health protocols that have been in place and have been there for a very long time.
Go ahead with your follow-up, Olivier.
Sure, merci. My second question would be for you, Premier, as well. Yesterday, we heard that Minister of Municipal Affairs, Chuck Porter, had a meeting with municipal leaders around the province. So what did you learn about their financial needs, for example, and what kind of help from your government will be available for them?
Minister Porter has been working with our municipal leaders, and I want to again thank the mayors and wardens across the province and councillors who've been working and representing their communities. They had a meeting yesterday, laid out their issues. They provided some potential ideas and solutions, and we're working our way through that, and Minister Porter will still collaborate them, and when we have a final decision, we'll communicate that to Nova Scotians.
Next, we'll go to John McPhee from the Chronicle Herald.
Thank you. This is for Dr. Strang. I've been hearing again from home care recipients today that they feel the sector of care is being ignored in terms of the consequences of the outbreak. Are we keeping track of the situation? For instance, do we know how many home care workers and home care recipients have been diagnosed? Like we seem to have a lot of details about the nursing home situation, but home care doesn't seem to be part of the picture here. Is that fair?
No, the numbers that I referred to and what's going to be in the now moving forward in the daily press release, their continuing care sector, which includes both long-term care and home care. So the 23 staff that we're reporting today, that's a combination of both long-term care employees as well as employees in the home care sector as well. That continuing care table is focused on both areas, long-term care as well as home care. And we're just like we've developed protocols and now a directive for long-term care, we have developed a number of infection control, occupational health related and patient safety related protocols for the home care sector. Those are in the process of being developed into a more of a directive like we have in place for long-term care. So I think there's appropriate attention being paid to both parts of the continuing care sector. Well, then and there's a third part that's been looked at as well that you didn't mention, but it's part of our work as well, which is in the residential care facilities, which are they're not long-term care, but we have residential facilities for adults with a range of disabilities, and that's also part of the work that we're doing, partnership between the community services who support some of these facilities and the healthcare system who also supports them.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
For the Premier, the federal government announced today they're planning a commercial rent program. Do you see that rolling into your existing rent deferral program and taking some pressure off provincial finances? Or do you think it will be a standalone program offering additional support on top of what's already offered?
The details of that we don't know yet. I think in the release they said the Prime Minister will be talking about that tonight with premiers on first blush, anything they can do to help. And I've been talking about this now for really since the very beginning of this outbreak, was around the commercial side of this, to landlords to be able so they could pass it on to many of our small business owners in the province to give them an opportunity to further rent over a period of time. So I consider it a positive step forward. The national government is involved when it comes on the commercial lending side, and I was, there will obviously have to be some protocols associated with it to ensure that it goes directly to the benefit flows down to the small business owner, but we will look how we can blend those together.
Go ahead, Lindsay, with your follow-up.
Yes, in regards to Dalhousie's involvement in the provincial financial aid programs, I know they were supposed to brainstorm ideas to support people and businesses. Could we get an update on that? Have you heard from them? Are there any additional aid programs coming?
We're obviously looking at some potential programs. There's some, we're looking at who's fallen through the cracks here. There's been some businesses that necessarily haven't been forced to close because of the public health order. They've been forced to close because of, everyone needing to stay home and self-isolate. So we're having to look at those, just as we looked at people who didn't qualify for some of the other federal programs. I was pleased to see that the federal government amended some of its criteria around its lending mechanism for a small business, now down to $20,000 as opposed to $50,000, and it's in excess of $1 million. Those are all positive signs, which will include more Nova Scotia businesses. So yeah, we're going to continue to look at that. As a matter of fact, Minister McClellan had a conversation with him today about possibilities and what we may be able to do for those that have, for whatever reason, have been missing in some of the aid packages coming forward. And I appreciate the question because it gives us an opportunity as a province, and particularly here in Atlantic Canada. We are working extremely hard as provinces to make sure that we're not necessarily adding on top of a federal program, but we're actually trying to make sure we mitigate and support those who aren't able or eligible for a federal program. There's been many talk opportunities where cost share program with the national government, all of those things, while it's important that they have a national program, they need to be sensitive to the reality is that their program is benefiting some and there's someone who's being left behind, and that's where I think the provinces need to come in, and that's where our focus has been on those who've been completely unemployed. How do we support them in the short term? How do we broaden the EI for self-employed or those that don't qualify? All of those things is where we put our focus and where we'll continue to put our focus, and it's really to supplement and offset some of the programs the federal government has that someone maybe missed or didn't qualify for.
Next, we'll go to Chris Hullef from News 95.7.
Thank you, Tina. This question's for the Premier. The province announced weeks ago that the sport fishing season would be delayed until May 1st. I'm just wondering, is that still the case, or is the province considering looking into extending that delay?
It is still to May 1st, and we haven't looked at extending it or not. We'll in the next week or so we'll continue to talk to public health, same as we will when it comes to the schools. As you know, they're closed until the 1st of May, ready to be open on the 4th of May. We'll look at all of that, but it will be in conversation with Dr. Strang of public health and where we are, quite frankly, with this virus.
Go ahead if you have a follow-up.
Yes, this question is also for the Premier. I understand you'll be taking part in a call with the Prime Minister and other premiers today. I'm just wondering what you plan on asking the Prime Minister for, or what you plan on bringing to his attention during that call today.
Well, as back to my previous comment, the federal government has been very responsive and willing to adjust programming. As you know, the small business program that they had out excluded a fair number of Nova Scotia businesses. They moved that flexibility and criteria today, which we were pleased to hear. I'm pleased that they are moving on the commercial rent side, which means that'll push that down, and hopefully that small business owners will see the benefit of that. Those have been out of direct conversations with Deputy Prime Minister Freeland and the Prime Minister. All Canadian premiers have been working through this. That's why these calls are critical. We will look at some of the programming that the federal government has been talking about over the last number of days and see how that works for Nova Scotia individuals and businesses, and look at how can we best adapt that. I had a call last night with the Atlantic Premier so that we would look at this from a regional point of view. We have a lot of similar interests, whether it's in the fishing sector, whatever the sector that's temporary foreign workers in the agricultural sector, the fish sector, all of those are common to us. So we looked at those and how we could best work with the national government to help this region. But I want to tell you, regardless of the political stripes, premiers across the country, everyone has been really focused on how do we best create a system with the national government, programs with the national government that understands our regional differences, but quite frankly has been focused on Canadians and Canadian families and businesses. And it's been really a tremendous experience to be able to sit around the table with people who have set aside, quite frankly, their political differences and focus on what's in the best interests of the country.
Next, we'll go to Kyle Shaw from the Coast.
Hi there. 2 weeks from today, it's the end of April, which means the end of apartment leases for the traditional university year, which means thousands of people in Halifax and across Nova Scotia will be moving apartments. Is the province given any thought to figuring out how to minimize potential COVID spread during this mass movement of people?
Well, we, as when it came to university students, if they're not from Nova Scotia, we encourage them already to go home. Those Nova Scotians that are here, we encourage them to self-isolate in the community that they're from. We'll continue to work like we do with every sector. If there's an issue associated with that, we'll work our way through that and continue to make sure that people follow the public health protocols of ensuring self-isolation, distancing, and no gathering more than 5. And we'll continue to make sure that we can deal with it. I don't know if you have any.
I will continue to work with the university sector, as the Premier said. With your comment, I'm going to go back and check an indication from the universities. But often the movement is when residences close down, and then people are looking to move off campus, and those residences are pretty empty at this point. We're dealing with some foreign students, but I think we'll have to continue to look at that. As there's a number of things coming in May 1st that we need to look at in the next week or so, as to how we continue to have an appropriate public health response.
Go ahead, Kyle, with your follow-up.
Okay. Now to funerals. We've had 3 deaths in the province. What's the current best practice for funerals and end-of-life ceremonies for Nova Scotians, whether it's someone who has unfortunately died from COVID or any other cause at this point?
So 2 things. I've had communication with the Funeral Directors Association of Nova Scotia, ensuring that they have best practices in place in terms of handling people, bodies where there's a death, including the concern that it may or be COVID or confirmed COVID. There's a national document which has just been finalized, on this as well, which I'm going to circulate as soon as I get it. In terms of holding, whether it's ceremonies or memorials, funerals, those have to be done in a way that respects the requirements around social distancing and no more than 5 people for essential gatherings only.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. Earlier, I was asked a question about the agricultural food security, and I raised the issue of temporary foreign workers coming into our province. We have worked with the agricultural sector to develop strict public health protocols. Before these workers get on a plane to come here, they are assessed for any signs of COVID-19. Upon arrival, they are taken directly to a number of large farms or other locations where they're quarantined for 14 days. Food will be brought to them, and they are to follow all protocols: washing hands, physical distancing, and self-isolation. And each day, they will be monitored for symptoms. When the 14 days are up, they will go to work on our farms, as they have every spring for many years. For many of these workers, they've become part of our farming families. They play a very important role in the agricultural sector, and it's their hard work and the hard work of the men and women who are farming in this province that keep food on our tables and helps to keep our economy moving. And we are grateful that our temporary foreign workers are here. I want to reassure you that everyone coming into this province must follow public health protocols and self-isolate, and there are no exceptions, even for temporary foreign workers. COVID-19 has created a lot of chaos and confusion. COVID will eventually leave our province, and it can't leave anytime soon enough for me. But while it's here, let's not let it control us. Let's stay true to who we are. Let's not allow this virus to take away our respect for one another. The kindness and compassion that Nova Scotians are known for should be the hallmark of what we continue to demonstrate to one another and those who are coming into our province.